Hello, everyone, and welcome to Question Pro's very first conversation about clinical burnout with my colleague, Jenny. We're really excited to be here today. Let me take 2 seconds and introduce myself. My name is Artie Pullins. I'm the President and Chief Healthcare Officer here at Question Pro. We'll be having a pretty exciting conversation today about clinical burnout. Jenny, give everybody a little bit of your background.
Hi, my name is Jenny. I work predominantly with our hospitals and healthcare industry partners at Question Pro. And so similar to what Artie was saying, we're hearing a lot about clinical burnout. So we thought we wanted to hop on today and talk about it.
Sounds great. Yeah, this is a pretty interesting topic. You'll see on our next slide how big this market is. I think every single one of you on this call who works in healthcare or understands the healthcare workforce, there's about 14 million people that are actively employed in the US healthcare system. And the data is pretty striking. About 46% of the people in healthcare are actually saying they feel kind of burnt out, which is really really sad to see when all of us in the United States consume healthcare, go to the hospital, go see our doctors, go see our nurses all the time. Jenny, I know personally, recently, you just gave birth to another beautiful baby, and you've been spending a lot of time in hospitals and the doctors for good reasons. What do you think about not only the data that we are seeing?
I mean, it's interesting because, we're in the hospitals all the time. It doesn't really click until you're there and you're like, oh my gosh, I'm definitely seeing the effects of it. Like the wait time's longer. It seems like when you're getting in there, doctors and nurses seem more rushed. It kind of seems like they're more frustrated. So it's interesting now to see the data and the research going behind it, and then going on the other side and experience it firsthand. So it's pretty interesting to see.
Absolutely. One of our slides, I think we're having some technical issues, so our team will fix it in moving through the slide. Thank you. In the next slide, it kind of talks about what are the 3 symptoms that are happening due to burnout. Exhaustion is one of them. Being depersonalized, which basically means when all the data that we see, the hospitals we talk to, the clinicians, the doctors, the workers, you enter the space of healthcare, to do what you love, which is patient care, and burnout really affects it. I mean, it's really sad to see the clinicians that are in the field and have taken the oath of taking care of patients, how much this affects us, and it drives. In our next slide, you'll see it talks about ineffectiveness, and that just means you kind of don't feel like this is what you wanted to do and wanted to do in healthcare. Jenny, any thoughts on that? On sort of, I feel really bad for this first person who seems so exhausted, but you see them all hunched over. Right? It's relevant, right? In the healthcare industry, according to what you were seeing.
Yeah. So even, on a personal level, of course, when I'm going into hospitals myself, like you said, a lot of kiddo appointments, I'm seeing it firsthand, but then also when I'm speaking with a lot of our partners, they themselves seem exhausted, right? They are like, I don't have the bandwidth to do this and that. I'm exhausted. It's meetings back to back, or, hey, I had this meeting, I had this call. So, when I'm talking to our personal partners, I'm definitely seeing the effects on them.
Absolutely. On the next slide, we'll talk about ARC and our data that we collect from a national benchmark standpoint. And these are industry standards that get reported out every 2 to 3 years through the ARC database. And again, very stark data that we're looking at here, right? And even outside of the pandemic, this data is from 21 and 22. We'll show you some more relevant data with our customers, but you can sort of see the year-over-year change happening between workload, patient care working too many long hours, which has been pretty consistent, and the pace of this and how it's sort of negatively, excuse me, affecting this industry. What do you think about this data, Jenny? And in your experience, how are our customers in hospital systems in North America looking at this ARC data for their own benchmarks?
Yeah. I think it's kind of like what we just focused on these few questions here, but there's a ton of other questions that try to capture the overall what's going on within the workplace. But yeah, just from here, seeing these 2 years, we're seeing an increase and decrease where we don't want to see them. And so when we look at a case study that we'll show in just a little bit, you'll definitely see that. And I'll also talk a little bit about like we'll see definitely the changes from pre-COVID, because that definitely has taken effect on the healthcare industry. And so what we kind of suspect and what we're hearing in conferences and a lot of other webinars, you're definitely seeing it now in the data now that we're pulling it.
Yeah, absolutely. And that kind of brings us right to the point about a current partner of Question Pros, a large healthcare system based out of the West Coast, that are seeing sort of these post-COVID era data points coming out of their survey, that they're utilizing the ARC data, the survey platform through Question Pro, as well as understanding what their clinicians, staff, team members within their health systems are going through, and what, most importantly, what are these patient officers, chief nursing officers, chief medical officers, what are they doing together to sort of improve? So, Jenny, why don't you talk us through sort of the data here on what you are seeing with some of our customers?
Yeah. So with some of our clients, we're able to see overall as the hospital, how's everyone feeling about, is it, how do you feel as far as leadership goes? How do you feel as far as staffing and hours and communication? And then the interesting thing is kind of like what's showing right now is we're able to break it down by department. So if we're noticing, hey, there's a really big problem in communication, they can use the tool and they use the platform. They can really drill it down to say like, hey, nurses are really feeling the effects of the pace of the unit within the unit, right? Work hours are really affecting nurses. They're really affecting the oncology department. They can really drill it down to unit, to department, facility, so that they can help to roll out the next plan. The next thing now is, what do we do about it? So the first thing is trying to identify what the problem is and where it's happening. So what we've been able to help with is to be able to see that. One of the partners that we have currently, they've been with us for quite some time and gathering information. So from 2019 all the way to 2023, which is their most recent, we've been able to compare the data that we have. So you see like pre-COVID, and during COVID time, it was starting to, we were seeing like a decrease and an increase and improvement on certain areas. And then shortly after COVID, now you're starting to see the numbers creep back up. So we're definitely starting to see, more of the work pace is a little bit more rushed than we want it to be. We're relying too much on temporary staff. So there's still that effect of being understaffed within the hospitals. And then longer hours, right? And then there's just not enough people, not enough time in the day to do everything that needs to be done. So we're starting to see that trend where it was starting to improve in a lot of the cases with our clients. And then now it's starting to kind of creep back up to be more of an issue again. So this client is currently still gathering data for this upcoming year. And we're actually still starting to see a trend where it actually has, there's some areas that we need to work on.
Yeah, no, absolutely. And what's interesting to me, when I looked at this data point in conjunction with the baseline data that all of this is reported against from the ARC database that we partner up with as well, is you would think, instinctively, pandemic, crazy times. We all went through it globally together. So all of these percentages should actually be in the red, right? They should be a huge amount of increase. But it was very interesting, the amount of, and we'll look at some of this data we collected third party later on as well. But yes, it was a time of turmoil, but it was sort of focused turmoil in a way, versus now everything has, to Jenny, to your point, opened back up. People are going back to the versioning of normality. But everything is creeping back up, right? Like the negative effects of the lack of patient safety and patient care is going up, which significantly hurts morale, of overall workforce culture, overall the reasoning of why people get into the clinical work, the long hours. You're absolutely right. That was even pre, during, and now post pandemic, and it's almost like a makeup, right? Because health systems in this is more of just the United States data, but because some of the preventative care routine checkup work wasn't really happening, now that's all happening. Like just think about it from our standpoint, the amount we used to go see our doctors kind of stopped for a little bit, right? And now has kind of peaked. So that snowball effect is catching up. Mm-hmm. And then you're absolutely right, staffing. We did another study with one of our partners, Medics, back in, I want to say in Q4 of last year. We'll release that data to the audience as well, that talked about staffing shortages within healthcare because of this sort of influx that we're seeing. So it's really interesting. Instinctively, you would think, oh, things are getting better, but it's almost like that domino effect that's happening. And it's great that we can collect this data through our survey platform and through our technology to get back to our customers, and then they can actually create action planning and next leapfrog ideation next to it. So let's look at what this organization is doing in their listen, learn, plan, and then repeat models. Why don't you walk us through that, Jenny?
Yeah. So something else that we're looking at, not just like staffing and how much work you're doing, but also just like overall support from the organization, or support from your leaders, because that in itself can make a big difference in whether you feel burned out or not within the hospital. And so there's some other points that we have and we take a look at within our data points that talks about mental health, right? Valuing their input. There's some other questions that talk about, do you feel safe asking questions if there's something going on? Do you feel safe mentioning anything if you see that something's going on? So with there being an increase in having more of a negative impact we're seeing in the medical industry, it'll be interesting to really take our data that we have, use the tools that we have, and slice and dice the analytics for our clients to see if those are correlated. Because, seeing if, hey, maybe, we can't really help. There's a ton of people coming into the hospital, but, we have leadership and we can really target and make a difference as far as how we help our employees feel supported and really back them up. So we're hoping.
Yeah, no, absolutely. I think this data point right here, right, of 31% of healthcare professionals are saying that their feelings and their emotions and their burnout is kind of being undervalued. And that's an interesting tidbit, because one of the tidbit, I can think of a different word, an interesting data point is because we hear, Jenny, you and I, from our customers, from our IDNs, hospitals, acute, post-acute customers, we hear a lot of, hey, we want input, and we're not actually getting input, right? Our responses on these ARC surveys and culture of safety, workplace violence, burnout studies are actually low. So it's really interesting on how the data comes in, how questions get answered by employees and your team. They're feeling this pressure. And now what do you do as an administrative team, right? CHROs are incredible patient safety officers and clinical needs officers, in order to create an action plan of same thing, kind of our theming of listen, learn, plan and repeat.
Right. Exactly. And And you see that a lot where we gather the data. They're like, okay, we know we have to put a survey out there, right? They put the survey out there, and then, okay, now what? All right. So that's something where we've been able to partner with a lot of our clients and really help them, like, hey, now, empower, let's get an action plan in place, right? Let's go ahead and track this data. Let's throw out another pulse survey. Let's check in and see how we're doing. Let's do an annual survey. How did we do compared to last year? So I think we're seeing a lot of partners be more and more excited because now they're like, okay, it doesn't just stop at gathering the data. Now we have the what now. So
Yeah.
that's been very
No,
exciting.
absolutely. The what now? I think that's the most important, right? Repeat, listen, learn, plan. It's that planning, repeat, and then re-listen idea of it. And through action planning, through making sure when the data is collected, the surveys are run every 2 years or more frequently, use an action planning tool. Yes, we have one in case anybody's interested. But there's plenty available in this industry that you can go and plan. But here's the interesting thing. Yes, you can plan, you can listen, and you can your clinical team and your non-clinical team can take action. But here's a interesting word and a controversial word that we'll talk about in our next slide: AI and generative AI. And how do we use that? Or is it being used in the field right now after you capture the data of, oh man, look at my clinical burnout and look at the amount of challenges that's causing. So walk us through some of this high level data here, Jenny. This was a report that was done between Question Pro and one of our partners, Day One Strategy out of the UK. We'll share it in the link here as well for anybody who would like to download it. But walk everybody through sort of what this data is showcasing from a time save standpoint.
Yeah, I definitely think when we're speaking to clients, AI is like a hit or miss, right? You're either really scared of it or you're like super excited about it. And a big part of it is that a lot of partners are leaning towards and excited about is, hey, it's going to cut down a lot of my tasks. And that's something I can always use help in, right? So that's something that a lot of people are very excited about is in regards to AI is how much can it help me to take off my plate? And especially we're talking about being overworked, where there's not enough hours in the day, there's not enough hands or people to help me to do certain things. They're very excited when it comes to at least taking off taking some of their tasks away from them so they can focus on other things.
Oh, absolutely. The administrative burden of healthcare continued to accelerate. It was already accelerating it a little bit. And of course, the pandemic kind of created a Pandora's box effect and sort of all the goods and the bads kind of came rushing out. So generative AI and the use of automation and the use of artificial intelligence technology is really helping in some of these administrative tasks. That is helping eliminate burnout. And you can see over 57% of healthcare professionals that we went and talked to, the sample size is over 501 clinician specialists within the healthcare industry who we spoke to go and talk about how can AI tools reduce burnout and clinical burnout and create efficiencies. And some of the data collected in the next slide, this is just high level. There's a lot more data where this came from, is what can chatbots, virtual assistants, clinical assistance from a clinical pathway standpoint, as well as integration within your EHR systems and EMR systems really do to create efficiency, to create less workload, to create less administrative burden, in order to let clinicians do what clinicians do best, which is taking care of us sickies and us patients to make us better and give us more remedies. I know last slide, but definitely not least. I know Jenny and you and I can probably talk about this all day. We want to be respectful of our audience, but walk us through some of these 4 skills, data points we are continually seeing within the health system and within hospitals in order to both help data collection and reduce clinical burnout.
So when it comes to what we're seeing is, and a lot of the questions and feedback that we're trying to collect is surrounded around these things, right? So we want to make sure that we're able to make sure that we have proper training for healthcare and the staff. And we make sure that they are feeling heard. And when it comes to decision making, that they're a part of that. And then also just patient-centered care is the most important thing. The reason why we're doing all this and gathering all this information is we want to provide the best care that we can for our patients, right? That's the whole reason why everyone is in the healthcare industry. And then we do all that by collecting the information and getting that feedback from the employees, so we can help to push that out to the hospitals so they know what to do next.
Awesome. Thank you. I know this was a very quick conversation between Jenny and I. Stay tuned for more. There will be more conversations not only about clinical burnout, but patient care, quality of care, as well as value-based care, feedback loops that we as Question Pro are partnering with our customers, both domestically and globally, in order to collect proper feedback and create channels of action planning. If you have any other questions, feel free to drop me a note down here. This video will be linked all over our social channels, or feel free to reach out to Jenny and I directly, and we'll share that information at the end of the recording. Thank you, everybody, and thank you for joining us today.